Welcome back. In this video, we're reading the Jaemi blog, The Hidden Crisis, Failure to Provide Medical Transportation in Healthcare Today. Let's get started. In the United States, access to healthcare is a basic human right. Yet for many individuals, a crucial barrier stands in the way of receiving the medical care they need: the lack of transportation. This issue is known as the failure to provide medical transportation. It's a significant obstacle that leads to missed appointments, disrupted care, and ultimately poor health outcomes. In this blog post, we will delve into the impact of this issue on accessing healthcare, explore the challenges faced by those affected, and discuss potential solutions to overcome this critical barrier. Join us as we shine a light on the invisible struggle of those left behind by the failure to provide medical transportation. Understanding the scope. The lack of medical transportation is not just a minor inconvenience. It is a widespread issue affecting millions of individuals across the United States. A study published in the National Library of Medicine revealed that in 2017, approximately 5.8 million people, accounting for 1.8% of the population, delayed seeking medical care due to transportation barriers. This staggering number highlights the profound impact that the failure to provide medical transportation has on individuals' ability to access essential healthcare services. Disparities in access. Notably, the burden of transportation barriers falls disproportionately on individuals who are economically disadvantaged and those with chronic health conditions. This vulnerable population often struggles to afford private transportation or lacks access to reliable public transportation options. Consequently, they face significant hurdles in attending medical appointments, obtaining medications, and accessing vital healthcare services. The disparities in access to transportation further exacerbate existing health inequities, perpetuating a cycle of poor health outcomes for those already facing significant challenges. Disproportionate impact. When it comes to the failure to provide medical transportation, the impact is not evenly distributed. Individuals who are poor and living with chronic conditions bear the brunt of this issue, facing significant hurdles in accessing essential healthcare services. Addressing the disproportionate impact of transportation barriers on marginalized communities is crucial in ensuring that everyone has equal access to quality healthcare. By acknowledging and actively working toward overcoming these disparities, we can move one step closer to bridging the gap in healthcare access and improving health outcomes for all individuals, regardless of their socioeconomic status or geographic location. Through targeted efforts and strategic partnerships, we can create a more equitable healthcare system that truly serves the need of every individual. Consequences of missed appointments. When individuals miss medical appointments due to transportation barriers, the repercussions can be severe. Here are some of the key consequences of these missed appointments. Disruption of continuity of care can result in ineffective management of chronic conditions and delayed diagnosis of new health issues. Increased healthcare costs, like transportation barriers, often force individuals to seek care in emergency rooms, which is costly and inefficient. Worsened patient outcomes. When they miss out on crucial screenings, tests, and follow-up visits, this can lead to worsened health outcomes, increased disease progression, and ultimately a decline in overall well-being. Psychological impact. The stress, anxiety, and frustration of not being able to access necessary healthcare services can lead to feelings of helplessness and isolation, further impacting their quality of life. In conclusion, the consequences of missed medical appointments due to transportation barriers are far-reaching and detrimental to both individuals and the healthcare system. By addressing these barriers and implementing solutions to provide access to medical transportation, we can help mitigate these consequences and ensure that all individuals have equal opportunities to receive the care they need for better health outcomes. Ensuring equal access. Specialized transportation services play a crucial role in ensuring equal access to health care for all individuals, regardless of their transportation limitations. By providing dedicated services for those with mobility challenges or for financial constraints, Healthcare systems can bridge the gap and ensure that no one is left behind due to transportation barriers. This proactive approach aims to create a more equitable healthcare system that prioritizes the needs of every patient. Healthcare costs. Healthcare costs are significantly impacted by the failure to provide medical transportation. When individuals are unable to access primary care and preventative services due to transportation barriers, they often resort to emergency rooms for acute care, resulting in increased expenses for both patients and the healthcare system. Missed appointments contribute to the inefficiency of healthcare delivery, leading to unnecessary expenditures that could have been avoided with proper transportation services. By addressing transportation barriers, healthcare providers can reduce the financial burden on patients and improve the overall cost effectiveness of the healthcare system. According to a study by Kaiser Permanente, 3.6 million Americans are prevented from receiving medical care each year due to transportation barriers, resulting in a significant strain on the healthcare system. Improving health outcomes. In conclusion, the failure to provide medical transportation is a crucial issue that impacts the lives of many individuals across the United States. The inability to access health care due to transportation barriers leads to missed appointments, disrupted care, and ultimately poorer health outcomes. Addressing this issue requires a collaborative effort involving specialized transportation services, community organizations, and government initiatives. By working together to provide reliable and affordable transportation options, we can help individuals overcome this barrier and access the health care they need. Improving health outcomes for all individuals, regardless of their transportation limitations, is crucial in ensuring that everyone has the opportunity to lead healthy and fulfilling lives. Let's continue to shine a light on this issue and work toward a future where everyone can access healthcare and where healthcare is truly universal. Alright guys, so that's it for this video. Remember to leave a comment letting me know what you think. Remember to like this video and subscribe to my channel, and go over to Tumblr and follow our Tumblr blog at Just Jaemi. Stay safe out there, and I'll see you soon.